Some of the myths were like you would attract sharks in the water.
That is absolutely
Insane.
Your vagina is self-cleaning.
Which I think is just an epic brag. Dr. Becca Thomas, welcome to What the Flo. Now, as a doctor, TMI doesn't really exist, does it, in your vocabulary? But while you were growing up, how did you actually learn about your body?
I grew up in Wales, and actually one of my kind of early, I guess, memories of having a period, one of my first periods probably, was when I was about to go on a school trip. My period was due to come on and I was a bit, oh gosh, this is going to be really embarrassing. And, my mum suggested telling the teacher, and then I was even more embarrassed. And, there was a conversation of should I even go? And of course I did a lot of sport growing up. That's the other way that I learned about my body really, because, when you're doing whatever, I was playing a lot of tennis and I do some competitions. And really for me, pads, for example, weren't going to work. So I was quite an early adopter of the tampon.
I was the same. I danced. And so I did. Yeah,
I was like, obviously, you've got to do what works for you. But when I was kind of presented with these two options, I was like, get it in me.
Get it in me, she says.
I can't, it's just not going to work for me, the alternative. So, I can certainly remember in sports lessons, lots of people not doing a PE class or sports class because they were too worried about their period.
I remember getting a book called Girl Talk.
Oh, yes.
And myself and my sister. And it was like, you'd read it. It was almost like in hushed tones.
Yes.
We would find out about these things with like I'm not at 117, but like it sounds like that. It was black and white, the pictures. And it was quite a thing.
Yeah.
And then I remember again wanting to fight back, so knowing that there was something a bit hushed about periods, so we couldn't talk about them. So I'd wait until family gatherings and go, Mom, what's a period? I kind of always had this instinct to want to ask the question that was unaskable or seemingly unaskable.
We didn't really discuss enough, I think, because I think if it was a bit more open and out there, and I think now...
Yeah, it was whispered.
Yeah.
Becca's got a period.
And I'd have a little period pouch or like with all my period paraphernalia. Yes. You'd be like, can I go to the toilet?
See, I was a late bloomer and I always wanted to get the little contraband. Like, when someone would be caught short and then you'd have to like literally get whatever into the hand, off you go. Yeah. It was like kind of quite glam in my mind. We label topics too much information, right? So they're this kind of, okay, TMI, I don't need to hear about what exactly is happening down there. But actually, there are topics that we don't talk enough about. And Flo's Secret Chats is the most amazing resource where you can go on and like without anonymously post questions about all sorts.
Yeah. Yeah, and that's the thing. We, open that conversation. It gives that ability to talk about what you want with other women and girls that are experiencing the same things as you, really.
Yeah. And check if it's normal.
Exactly.
Or not. And say it without self-consciousness.
Exactly. Nothing is too much information, really.
In fact, it might be too little information. That's the truth of it, isn't it? Okay, so I am going to ask you a few of the questions that came up in Flo's Secret Chats. Does anyone else have the most violent diarrhea during their period? Been on the toilet almost all day.
Period diarrhea, or sometimes as it's called, period poops, is, very common. The body releases a chemical called prostaglandins, which actually helps the uterus to contract and shed the lining. Now, those chemicals can actually affect the bowel, and that can cause women to have more diarrhea or looser stools around their period, basically.
So totally normal, but I think a lot of people think, is that just me?
Yeah, and it's important to recognise that, if you're getting severe diarrhea and that's something that's really affecting your life or it's a sudden change, then you should absolutely see your doctor about it. But it is something that can affect month on month.
So, second question, does anyone else experience a yeast infection or some kind of irritation during ovulation?
Many women actually experience a change in their discharge, moisture and pH around ovulation. This can cause some irritation to the vagina and the vulval area. It's important that if that isn't settling, though, that the irritation can be similar to the infection. So it's important to get it checked out, basically.
Okay, this one's about pubic hair. All the good ones today. Is it not necessary to shave for hygiene reasons?
Well, actually, having pubic hair is not unhygienic. Yeah. It's actually protective. It can help reduce friction. Mm-hmm. It helps support the skin's barrier. And actually, sometimes shaving can increase your risk of irritation and infection.
Also, back in the caves, we were not getting a Hollywood.
No. It is, it's absolutely a personal preference.
What is something that you cannot believe is not common knowledge?
What's pretty shocking is people's knowledge about the female anatomy.
Oh, you're telling me?
Yeah. A lot of people actually, you'd be surprised, people, don't know their bits and bobs down there.
Okay, so even we don't know our bits and bobs. Is that what you're saying? It's not just a male issue.
A UK survey actually found that over half of participants actually can't identify or describe things like their urethra, their labia, or their vagina. Ultimately, in order to advocate for your own body, you really do need to know your anatomy.
People generally have a more catch-all term for that area as opposed to understanding the actual anatomy.
I think we have become quite used to maybe not referring to things like the vulva or the vagina. And you might have grown up with your mum calling it something slightly different.
Yeah, like a foof.
Yeah, like a foof. I was trying to think of an example. I've heard of foof.
I mean, fanny.
Fanny is a classic. It's a classic. But I think, there's nothing wrong with getting used to calling them by the actual medical names, really. Yeah. Because, then when you grow up, you can go to your doctor and you know exactly what you're talking about. Or, you have a bit more of an idea.
Will you help me bust a couple of myths?
Absolutely.
Okay, I've got a little bag of tricks here. Okay.
Came prepared.
I did. Right, so I'm just going to... I don't know what's in here.
You don't know what's in there.
No idea. This is a bar of soap.
So yeah, this one is about, people think that you need a special soap to clean your vagina.
Right.
That is absolutely a myth. In fact, your vagina is self-cleaning.
Which I think is just an epic brag.
Yeah.
Don't you think?
Yeah, exactly. And actually, if you do use a soap to clean your vagina, it can upset the natural pH.
Okay.
And in fact, if you're getting things like cottage cheese discharge or fishy smells, soap ain't going to fix that.
Okay.
That's definitely not going to fix that.
So what? That's a bigger issue.
Yeah. I mean, because these types of symptoms can be caused by then using the special soaps.
Okay.
So you should be definitely going to a doctor if you're getting any of those things. But you don't need your soap. It's self-cleaning.
What about this? Is this self-cleaning?
This, I wish. This
sports bra.
Is a sports bra.
Yes, it is.
Yeah. This one is about people thinking that they can't exercise on their period.
Okay.
So, in fact, doing a little bit of exercise on your period can be really helpful. It can really help with cramps, bloating, even mood, because it boosts the blood flow and also releases endorphins.
Goggles.
Okay, this one is that some people think that they can't swim on your period.
What?
Well, I can understand it. Maybe they think they're going to...
The fear of it.
Maybe it's the fear.
Okay.
Yeah. And there's period products like tampons and period cups that you can use when you go swimming.
Some of the myths were a little more sinister, like that you would attract sharks in the water.
Yeah, I mean, you can actually go swimming without anything.
Yeah.
And you won't attract the sharks.
Okay, good to know. Let's talk about this. It's a hot water bottle.
It's a hot water bottle.
It's also a cute one.
This one is about period pain just being part of being a woman, basically. And of course, that is not the case. If it's severe pain that's affecting your life, this can be an indication of certain conditions like endometriosis. Okay. So, this isn't something that women need to live with and just, it's period pains, time of the month.
So once a month I'm taken out of it. That should not be the case, really.
No, and, if it is having a significant impact on your life, that, there's things that can be looked into and also, management around of that pain, so treatments, etc. So, I think I would definitely recommend going to the doctor and having a discussion about it.
These old guys.
Yeah. So, of course, this one is tampons take our virginity. That is absolutely
insane.
It's also insane. Virginity is not a medical concept. It's actually a social concept. And, when you use a tampon, it can stretch the hymen. But that is nothing to do with virginity or sexual activity at all. And I do remember that being spread around school as a myth. As a thing.
Okay, let's switch out of myths with frequently asked questions, okay? Starting with how much blood you lose in an average period. Okay, now I have some glasses. We're going to do a test, okay? Because I have to say, since I use a moon cup, I have a greater appreciation.
Yes, I guess if you use a moon cup, you know how much.
Well, you have a little bit of more clarity. And I then am able to be kinder to myself because I'm like, babe, that's not
I'm
nothing.
Going through it.
Yeah. So, okay, we're assuming.
So I'll let you guess first.
Okay. Okay, so how many days are we talking?
This is what the average woman loses over
in a cycle.
One period. Yeah.
Okay. Okay.
You know what? I'm going to say you're spot on. Yeah. Essentially, a woman on average will lose between 30 to 50 millilitres, which is actually about 2 to 3 tablespoons. I don't know. I'm going to see if I can get it roughly the same. Oh, I think I've gone over. I think actually that's all right.
But I do think knowing that you're losing that much blood allows you to be a bit gentler with yourself.
It's not filling the glass, but that's a lot.
If that came out of your leg, you'd be concerned.
You would, absolutely. This is an average amount. And actually, some people do suffer with heavy periods.
Yeah.
If you're changing your pads or tampons really frequently, if you're having to change overnight, passing really big clots, or actually bleeding for a long time, like over 7 days, it's time to see the doctor. If this just seems like a bloodbath and you're just not managing, you're not able to go to work, you're not able to go out, just go and see a doctor because you don't have to.
That's not
cope with that.
Normal, but you don't need to suffer that.
Yeah, exactly.
We've all been down a kind of late period spiral stressor.
Yeah.
What counts as a late period?
A period is considered late when it doesn't arrive around the time that you typically expect it based on your cycle pattern.
So that suggests you need to know what your pattern is.
Yeah, and funnily enough, there are apps like Flo that can help you track your period and help you know when roughly that might come. Now, the important thing is actually a late period is often not something to worry about. If you are sexually active, you do want to think about potentially, do I need to take a pregnancy test? But actually normal healthy cycles can actually vary up to sort of 7 days.
And that swing in either direction outside of a on the nose date, is that impacted by stress or lifestyle, or are there things that would kind of change that?
Absolutely. Those things can impact whether your period's going to come on time or not.
What's an irregular period?
So an irregular period is a period that essentially doesn't have a consistent pattern. It can be an indication of certain conditions. So it is worth getting it checked out for sure. So, there's 2 things you can do if you've got irregular periods. You can obviously track your period regardless, but then also track the symptoms around your period and in your cycle. And that's really helpful when you go and see the doctor and, you're all rushed and you've only got a short amount of time. You can actually download a health report from apps like Flo. That can then give your doctor a better overall picture of what's going on. Because, I've been there, I'm a GP, I say, when was your last period? And people, even if it was 3 days ago,
I mean,
there's
it
panic.
feels like a trick question.
Exactly.
I'm like, me? How am I supposed to know?
Exactly.
Yeah. So it's less about what's normal and more about what's your normal.
What's typical for you. Yeah.
You are a dreamboat. Can I get your number so I can message you with any further myths that I need busting?
Yeah.
Or general questions?
Only if you bring the props.
Thank you so much,
No
Becca.
problem. Yeah, well, it's been great.